I do not support a healthcare system that's totally run by the government, where we have, bureaucrats, Washington bureaucrats, who are suggesting who gets healthcare. Nor do I support a system that's totally run by Wall Street hedge fund managers determining who gets healthcare and who doesn't. When I started in the legislature, it was 41 million people in our country were uninsured or underinsured. It has grown to 47. They're predicting by 2010 it could be as high as 50 million Americans are uninsured or underinsured. Ohio has about 1.4 million uninsured or underinsured. I have visited with nearly every hospital in the 16th congressional district, and every administrator, doctors, and all the healthcare professionals that I speak with say that we need to find a way so that every American has healthcare insurance. Because if we don't, they're costing the system more. 1.5 million Americans die every year from chronic diseases like diabetes and heart disease. And now, if they're uninsured, if that diabetic is uninsured and they let that ulcer on their foot fester to a point where they now have to go to the hospital rather than seeing routine visits with their doctor, it costs the system 4, if not 5 times more money to pay for that individual who's underinsured or underinsured to go to the hospital and seek treatment. And we have the ability to do it. We certainly have the resources, because in 2004, our Secretary of Health and Human Services, Tommy Thompson, traveled to Iraq with one of many billion-dollar checks to ensure that every man, woman, and child in Iraq had universal health coverage. Now, you propose an idea like that in the halls of Congress. We can't afford it. There's no way. But yet we'll provide it for Iraqis. We won't provide it for our own people. We have to find a system that supports the employee-based healthcare system that we have, provide incentives, make strategic investments into the healthcare system to lower costs so that businesses and industry are not strapped by higher and marginal costs for healthcare.